Every day, my subscribers reach out to ask me a lot of questions, and I love it. In fact, I request it. But maybe by now you've noticed there are certain questions I never answer no matter what. And today, I want to talk about those forbidden questions. But first, I've got a question for you. What else do you want to know more about? Whatever's on your mind, leave a comment down below. And unless it's one of the forbidden questions I'm discussing today, I'll make sure to answer that. So let's talk about those forbidden questions and why I may not have answered your question yet. And first, let me remind you, even if it takes some time for me to answer your question, I do read your comments, and they're incredibly valuable to me. They help me decide topics here on YouTube and new formulas and so much more. So whatever you do, don't stop writing in. Just understand that I get a lot of questions, so it may take some time for me to give you an answer. But what questions can't I answer no matter what? Well, for one, if you ask me about a specific medication or even groups of medications, things get pretty tricky. Yes, I can say things like antibiotics are overprescribed and you should only use them in certain circumstances. But a lot of my subscribers write in asking about how certain diets or supplements may interact with their medication, or even if they should take any medication at all. And here's the thing, unless you're my patient, I can't answer that for you. It just wouldn't be ethical. See, your doctor knows your unique medical history way better than I do. And chances are, if they prescribed a medication, they did it for a reason. And it wouldn't be fair to you if I gave you advice about medication without knowing you as a patient. Now, what I can do on this channel is tell you all the things that you can do to stay healthy and support your overall health, which can go a long way when it comes to keeping you from catching seasonal bugs and the like. So no matter what unique health situation you're in, go ahead and follow the wellness tips on this channel and in my books. And if something seems like it won't work with your medication, ask your doctor about it. Heck, you can even pull up the video on your phone right there in the doctor's office. Now, along with questions about medication, one of the most common things I get asked is, can I follow the plan if I'm sick? For some people, they're talking about diabetes. Others want to know about autoimmune diseases, and others about cancer. And before I dive in, let me say this. If you're dealing with an illness, I feel for you. I know it must be pretty scary, and I applaud you being here, pushing forward and doing your research. Keep up the good work. But maybe you've noticed, I don't answer questions about how to fix specific diseases. It's kind of like avoiding the question about medicine. See, unless you're a patient of mine, I simply don't know your medical history well enough to tackle your specific diagnosis. And it wouldn't be fair to try, because I don't want to give you the wrong information, and I don't have the full picture of your health. So the best person to advise you on your specific medical diagnosis is a doctor who knows you and your history. Now, if you are curious about following the Plant Paradox plan during your treatment, I suggest talking to your doctor about it. If you check out my blog on the website, I've got printer-friendly The Plant Paradox yes and no list you can share with your doctor. And feel free to show them this channel or my books as well, because the Plant Paradox plan is designed to be nourishing for your body. It might be just the right way to eat when you're dealing with other health issues, but that's something for you to discuss with your doctor, because you're unique and so is your health, and you deserve the most customized care possible. So when you print out those lists and talk to your doctor, make sure to be assertive and explain why you want to try the Plant Paradox, along with your prescribed care, of course. Chances are, if your doctor sees that you're doing your research, they'll listen, even if they're busy. So there you have it, the two questions I'll never answer unless you're actually my patient. Now, this video is not intended to stop you from asking questions. In fact, I want to hear all about your health concerns, because while I can't shed light on your particular diagnosis, knowing what my subscribers are dealing with can help me decide what to put here on YouTube, so I can help as many people as possible live a long, healthy life. You deserve it, because I'm Dr. Gundry, and I'm always looking out for you.